HIV can affect anyone, but there have been significant advancements in prevention and care. Things like increased awareness, access to testing, and medications like PrEP can help prevent HIV. And for those who have it, antiretroviral therapy can suppress the virus and prevent it from spreading to others. However, research has shown that certain groups, particularly Black and Hispanic individuals, are less likely to use these preventative measures and have higher rates of infection. This can lead to worse outcomes for these groups. Let's take a closer look at the factors that contribute to these disparities in HIV infections and prevention and care. Many people who are at risk for HIV or are diagnosed with it face challenges and inequalities that can affect their access to quality care. These challenges can be influenced by factors such as socioeconomic status, race, gender, and political identities, which is known as intersectionality. Black and Hispanic people are more likely to get HIV and have worse outcomes. This can be due to limited access to prevention and care, fear of stigma, and lack of testing and awareness. Gay, bisexual, and other men who have sex with men make up a small percentage of the population but account for a large number of new HIV infections each year. Black and Latino men who have sex with men are at particularly high risk, especially those between ages 13 and 24. Black women are much more likely to be affected by HIV than white and Latino women. Similarly, transgender people, especially those who are Black, are also disproportionately affected by new HIV infections. When it comes to prevention, Black and Hispanic/Latino people have the lowest rates of PrEP use compared to other racial or ethnic groups. In 2020, only 9% of Black people and 16% of Hispanic or Latino people who were candidates for PrEP actually had a prescription for it. Disparities in HIV prevention can be caused by a variety of factors. Factors such as poverty, racism, sexism, lack of access to healthcare, lack of awareness about HIV, higher rates of sexually transmitted infections, and stigma can all contribute to these disparities. Research has shown that Black people often experience the worst discrimination, homophobia, and stigma related to HIV. In fact, 1 in 7 Black people who are HIV positive are unaware of their status, leading to a lack of proper care and unintentional spread of HIV to others. Discrimination and stigma can also have a negative impact on mental well-being, leading to feelings of loneliness, depression, shame, and anxiety. Additionally, implicit bias can affect how individuals are treated by healthcare providers, leading to barriers in accessing quality care. Structural issues such as food insecurity, homelessness, lack of transportation for healthcare, discrimination, and racism further worsen HIV outcomes for people of color. Additionally, Hispanic individuals may face additional hurdles due to their immigration status, language barriers, and strong family structures that can act as barriers to receiving preventative care. The CDC is working to improve HIV prevention and care for all by collecting data and monitoring HIV testing trends among minorities who are most affected, funding research to find strategies to help Black and Latino populations at risk for HIV, conducting HIV prevention research to reduce overall social and structural disparities, improving PrEP coverage at a local level, strengthening and improving the country's HIV prevention workforce, supporting local community-based organizations working to increase HIV testing and knowledge, offering resources in both English and Spanish, like Let's Stop HIV Together /Dayton Gamos Juntos LVIH. Non-profit organizations are also working to educate marginalized groups with targeted outreach to ensure access to testing and PrEP for all. For example, the Black AIDS Institute created a PrEP toolkit for Black women to use to educate other Black women on the importance of PrEP and how to get it. Advocating for yourself and your health is crucial to preventing HIV and fighting against discrimination. By learning about HIV, finding the right healthcare provider, asking questions, taking notes, and staying informed about HIV policies and laws, you can ensure you receive the best possible care and protection. It's important to communicate openly with your healthcare team and advocate for your needs to maintain a healthy life in the long run.